Hi everyone, this is Rory DeRemus, and I am a senior biology major at Keuka College. Have you heard the numerous claims of health benefits that essential oils bring? Essential oils claim to balance hormones, aid digestion, boost brain power, and support immune function. I'm sure many of you are aware of these claims and others made by aromatherapists and those selling essential oils. But is all their information accurate and supported by evidence? I hope to spread some knowledge on this topic and why you should investigate alternative medicine more. First, I want to explain the difference between alternative and conventional medicine. Alternative medicine includes acupuncture, reflexology, chiropractics, and homeopathy, which are practices that are popular and claim health benefits, yet lack solid evidence to support these claims. Conventional medicine is strongly based on evidence and continuing research. It's what is taught at nursing and medical schools to prepare healthcare professionals to deliver the best possible patient care. If alternative medicine practices could prove their claims, then they would be taught to future nurses and doctors because they simply would be conventional medicine. These oils are a liquid which easily evaporates, and we are able to identify them by smell. This property is known as being volatile. The oils contain chemical compounds that give off the fragrance and aroma or essence of a plant. Peppermint, lavender, eucalyptus, and rosemary are some popular essential oils. Since this property is what identifies oils from each other, it only takes a small amount of one essential oil in a mixture to define it from another. Also, concentrated essential oils are very expensive to produce from raw plant material. Because of these factors, the essential oils which are sold commercially for alternative medicine are usually less than 5% of what you pay for. Oils on the market are actually mixed with a carrier oil, including peanut, olive, and grapeseed oil, so that they can be sold at a reasonable price. Are we really getting health benefits when the product is at such a low concentration? The most popular use of essential oils is to aromatize them into a diffuser. The volatile oils easily diffuse into the air and claim to de-stress or relieve anxiety from the user. The pleasant smell may have a very short-term effect on your mood, but this will really not help a mental health problem. In reality, the amount of essential oil molecules in the air is insignificant relative to all the other molecules in the air. The air we breathe is made up of 99.5% nitrogen, oxygen, water vapor, and carbon dioxide. So the percentage of diffused essential oil in the air is much too dilute to contribute to health benefits. Using a diffuser to relieve anxiety is like lighting a candle to help your depression. Conventional medicine does have a similar technique, as it supports the use of a nebulizer with a volatile medicine. A medication like albuterol has active ingredients that act on specific cells and prevents difficulty of breathing. Albuterol's effect has been proven through years of research, yet diffused essential oils have not. Users of essential oils have another technique, and that is the topical application to many locations of the body. Many sellers claim that oils can have a significant effect on pain and inflammation to an injury site. Often, users will massage oils into the skin, thinking that the body can absorb and process them. There is some evidence showing that oils can have a mild effect on pain in local areas, but the sample is small, so that pain relief may just be the placebo effect. More on that later. Let's touch on the idea of oils being absorbed through the skin and showing anti-inflammatory properties. The outer layer of our skin, the epidermis, has 5 sublayers within it. These layers are our body's main defense against unwanted pathogens, and it's very good at its job. This fact makes it very difficult for any molecule to pass through the skin, into our bloodstream, and actually show an anti-inflammatory property. Also, there has not been evidence shown that essential oils actually pass through the skin into the blood. If they cannot get into the blood, then anti-inflammatory properties could never be observed. Conventional medicine does use the skin as an absorption site for some pharmaceuticals. Yet, these drugs have been chemically engineered to pass through the skin into our bloodstream. Essential oils are naturally occurring and definitely have not been engineered for human skin absorption. So why would we think that they can pass through the layers of skin, cross into the bloodstream, bind to specific immune cell receptors, and ultimately lead to less inflammation? A trend among essential oil users, which is increasing in popularity, is the intake of oils by mouth. This is usually for digestive help and antibiotic properties. This practice is quite dangerous and could lead to unintended consequences. Essential oils are considered a cosmetic product by the FDA, so they are not regulated for purity, concentration, and certainly not tested as a food product. It is unknown what is exactly in each jar of essential oils because there is little research and no oversight. So why would you take in something orally that you have no idea of its health effects? Peppermint oil is used for a digestive aid, yet it is toxic to liver cells. Wintergreen oil, if ingested, acts as a severe blood thinner. Nutmeg oil causes hallucinations. Eucalyptus, sage, and camphor oil are linked to increased seizures. According to the National Poison Control Center, it is advised to not take in any essential oils by mouth. Would you listen to this source or someone selling you bottles of essential oils? In terms of antibiotic properties, essential oils actually have been shown to kill bacterial cells in a lab setting. This testing was done on petri dishes, and positive results have been shown and are repeatable. Of course, there are several liquids that show antibiotic properties on a petri dish. They include ethanol, hydrogen peroxide, bleach, and ammonia. Although they show antibiotic properties, do you want to take in these products by mouth? Now, back to the placebo effect. This may be a phenomenon that you are familiar with or not completely understand. A placebo is a treatment which seems to have an effect on the user, yet it really has no active ingredient. This could include a drug, a shot, or even a sham surgery. Many times people will feel better if they are given something and told that it will work rather than given nothing. Placebos are often used in research to see if a new treatment works better than a placebo does. If a treatment works significantly better than a placebo, it can be considered an effective treatment. The bold effects of placebos have been recorded since the 1700s. The word itself was translated from the Latin phrase, "I shall please." Placebos have shown positive effects on depression, pain, sleep disorders, irritable bowel syndrome, and even menopause. This means a large number of people have described relief from symptoms even if they were simply given a sugar pill. Do you think there could be a link between the claims of essential oils and the placebo effect? With this in mind, let's talk more about essential oils. So imagine you are suffering from depression and anxiety, and conventional medicine has not seemed to have a positive effect on you. Then someone selling essential oils listens to your symptoms, and instead of writing you a script for some drug that you can't imagine how to say, they recommend lavender and chamomile oils. They tell you about personal anecdotes of their friends and family and how this natural remedy really works wonders to ease your mind. They know how to sell their product to others that seem to need an answer for their medical problems. Suddenly, you have 2 bottles of oil totaling 30 milliliters. It costs you $68. But then you also need a diffuser, which costs another $63. you take your products home to enjoy and wait for the results. After spending $130, I would want results too. Using your oils every day, you may feel some results, but how much does your purchase weigh into how you feel? This is perfect for the placebo effect to render false positive results. Now you have already spent the money on your diffuser, why not use it? So you keep spending money on new and exciting essential oils. But do you really see results all the time? I hope this video informed you of a booming industry in the alternative medicine world. That's right, the companies that make essential oils can clear some serious profits selling to a world of consumers. I also hope this video helped you understand some major differences between conventional and alternative medicine. Conventional medicine is made of evidence and based on research. Conventional medicine makes claims based on previous results that are testable and repeatable. Also, anything can be disproven if enough evidence is gathered. If you're selling essential oils and your customers don't see results, well, you can just recommend other products that might work. You won't let your customer disprove you, but the medical community can be disproven if their methods don't actually work. So next time you are buying essential oils, ask your seller about the research and evidence behind this particular product. Was this oil chemically engineered for my back pain? Did it show better results than a placebo? Does the FDA support the claims made by this product? If you can't seem to get a straight answer, maybe you'll think twice before buying.